There's so much of hype. I've heard actors like Kim Kardashian and all also go for this kind of procedure. What exactly is this procedure, Dr. Mohan?
What she injects, only she knows.
My goodness.
Okay?
Scary.
Now, this is just part of the story. Then some of them are so impressed by, because initially it looks fine, and so they call her again and have more injected. And today I saw a woman who has had 4 rounds of injections done by the same woman, inviting her to come to her home and inject her.
We have
illegal
done
substance.
really a great job by discussing this on our platform, making people
Thank you.
aware that this kind of practices are also
Yes.
happening.
Yes.
And they should be aware of it.
We know by now that this is silicone oil.
Oh.
Silicone oil, no doctor uses in any medical procedures.
This is so dangerous, my goodness. They will fight with each other probably. It will stuff,
there,
no?
there will be no oxygenation for all
Oh
this.
yeah, I remember once you
And
told
they will all
me.
die. I just want to tell people that do not go for these cheap offers of an unknown person, unlicensed. By now they should know
True.
that this kind of a service offered by somebody and they are invading your body by injecting something, and they are not doctors. They're obviously not doctors.
Curves, confidence, and transformation. If you have ever wondered how to achieve a fuller, more sculpted look, this episode is for you. Buttock augmentation is one of the most talked about procedures in aesthetic surgery, and today we are diving deep into the facts, myths, and everything in between. Welcome to this special episode of Med Talks with Dr. Anita in collaboration with Expert Medical Insights by Dr. Mohan Rangaswamy. I am Dr. Anita, and today we are exploring how buttock augmentation can enhance not just your shape but also your confidence. In this episode, we'll be answering some of the most common questions people have, such as what are the different ways to enhance and shape the buttocks? How can someone tell if this procedure is right for them? What is the recovery procedure like? And how long does it take to get back to the normal activities? Are there any risks involved, and how safe is this procedure? How long do the results last, and do they look natural over time? Dr. Mohan Rangaswamy, a leading expert in aesthetic and reconstructive surgery with over 35 years of experience, will share his expert insights and break down everything you need to know about this procedure. We would love to hear from you. If you have any questions about buttock augmentation or any other aesthetic procedures, drop them in the comments below. Don't forget to like, share, and subscribe to our channel Med Talks with Dr. Anita and also Expert Medical Insights by Dr. Mohan Rangaswamy for more expert discussions. Stay there. Welcome again.
Thank you once again.
Yes, we are here to explore more in plastic surgery and reconstructive surgery again.
We try to meet every month, explore hot topics, explore topics on which there are myths and ignorance.
Right.
And our job here is to open up the field, inform the public about various options available, the safety involved, and what's the correct way to approach self-enhancement through plastic surgery.
Diving deep into the procedures which are like, just for the people maybe just know by name, all the so coming from the expert. Yes.
Yeah.
Thank you so much once again for coming here. Today's topic is buttock augmentation.
It is.
Yes, and I am quite excited to know what exactly buttock augmentation is, and there's so much of hype. I've heard actors like Kim Kardashian and all also go for this kind of procedure. What exactly is this procedure, Dr. Mohan?
So, buttock augmentation is extremely popular, and here in UAE, it is one of the commonest procedures that I perform.
Oh, really?
That's true. That's true. So, there is an avid interest in enhancing the beauty in this part of the anatomy, human anatomy. And, let's start at the beginning. Why do women, I'm saying women because almost 99% of the patients that come to me for buttock augmentation are women. There's a microscopic, minuscule number of men that come due to certain specific reasons. Okay. We can delve into that if time permits. But women come for various reasons. One is just a personal desire to have a bigger anatomy there, bigger size, bigger dimension. Because beauty of feminine body and the desirability is wired into human brain from the Stone Age times.
Yes.
Because there's something called a waist-hip ratio. If you go back in history, in prehistoric times even, there are these terracotta figurines and stone figurines which show exaggerated buttocks and exaggerated bosoms.
Yes.
And these are called fertility figures. So generally, it's hardwired that a woman who has a bigger bottom is probably going to be more fertile and is going to be able to produce more children and sustain them better. Okay, so it's not conscious that way, but it is there deep in the wiring. But that apart, the waist-hip ratio is a sign of beauty in a feminine form. So the waist should be narrower and the hip should be wider. Okay. Now, a lot of people, due to genetic reasons or due to the lifestyle, obesity and sedentary lifestyle and so on and so forth, may not have an ideal waist-hip ratio, right? So the midriff may be thicker and the butt may be smaller. Now, this proportion is very much genetically determined and racially determined.
Okay.
Okay, and if I give you an example, you will immediately recognize this.
Like?
For example, let's take a woman, a black woman from Africa, let's say. She can starve herself as much as she wants, but she will still have a bigger butt.
Oh my goodness, yes.
She can be very super slim, but she will have adequate buttocks.
In the gym, I notice, I'm like, what kind of exercise these people they do to make this so huge?
It's genetics. It's genetics.
Whoa.
Now, you go to the Far East.
I'm sorry to interrupt you.
Yeah,
Still,
sorry.
they do glutes exercises to make it
Of
more
course,
bigger. I don't know
of
what.
course. We're coming to that. Okay, we're coming to the motivations in a moment.
Okay.
But if you go to the Far East, they can gain weight, but the weight will pile up on the middle part, on the tummy and hips, and the butt will not change one bit.
Okay.
So they're really sore about it, that my butt is not enhancing at all. It's boyish, it's small.
Right.
Now, that brings me to the motivations. So somebody who doesn't have a proper waist-hip ratio and really desires to have a better ratio, let's say, so enhance the butt. That is one category. The other category is, for example, conformity. For example, in the same African setup, let's say there is one odd woman who doesn't have enough butt volume. So she'll stand out and she wants to conform with the rest of the people to sort of retain her Africanness, let's put it that way. So to be able to conform to what is considered norm and desirable in that society,
Agree.
she may be keen on doing this. There is the other opposite end, that somebody who's deficient, for example, in the Far East, and conformity means everybody else is almost like that.
Yeah.
But she wants to stand out, she wants to enhance, she wants to say that why should I not have a figure that I'm seeing perhaps in some of the Hollywood movies or whatever, and she has
Right.
that desire to enhance the area, and it's possible. Okay, then there are others who have an abnormal shape. Now, when we look at the buttock shape from behind, it's been classified into A shape, V shape, square shape,
Okay.
or irregular shape. And if you actually now start analyzing and looking at people in that way, you will immediately see.
Now I will.
You will immediately see somebody who's like this. That's a V shape. So the ideal is the
Yeah.
rounded one. Okay.
Right.
But there is also the viola shape. Viola or cello. You know how a viola or a cello has this curve.
Oh, yes.
So if the hip is full, then there are hip dips, which is concave, and then
Right.
there is fullness in the outer thighs.
True.
So that's a viola figure.
Oh, yes, right.
And the viola figure, you just cannot change it by exercise or anything. The only solution is plastic surgery to do buttock beautification. So that brings us to the topic of what is popularly called BBL.
BBL.
BBL is Brazilian butt lift, and everybody comes asking me, I want BBL.
Wow. Brazilian butt lift.
Butt lift. So the only appropriate word is the middle one, the butt, because this is not a Brazilian only procedure, and this is not a butt lift, because we are
Okay.
not really lifting.
Okay.
What we are doing in BBL is contouring that area by taking away fat from the upper part and the lower part if it is bulging, transferring that fat to the mid part, which is actually the buttocks,
Okay.
filling out the hollows on the sides, improving the projection behind. And in the act of doing improvement in the projection, I could put more fat in the upper part.
So that lifts it up.
So it gives a
Automatically.
visual impression of a lift.
Okay.
So thereby the term was evolved, and it's catchy term. So buttock lift, BBL.
But why Brazilian? I mean, yeah, because of the...
No, well, these procedures were initially popularized by some Brazilian surgeons.
Okay.
And so they, when surgeons come and present at conferences, they like to attach the tag of their country. Somebody might say this is French technique, or this is Brazilian
yes.
technique,
Right.
or the Indian technique, or whatever. So they started talking about it as a Brazilian buttock lift technique, because they were probably doing it in hordes in the beginning. Now, of course, the whole world, everybody is doing Brazilian butt lift. Now, this procedure of buttock fat grafting received a big jolt of shock when it was shown in Florida that it can be potentially dangerous.
Oh, it can be dangerous as well?
That aspect is very important. Now, the danger is when the fat is injected under the muscle. There was a
Okay.
period of time when some of the respected surgeons were recommending that fat survives better when you put it inside the muscle, the gluteus maximus muscle, right? But then soon people realized that this fat, when you put it under the muscle, it can migrate through the veins
Oh, through
into the heart and
veins.
lung and cause
Fat embolism.
cause fat embolism and some dangerous complications. Now that is fortunately a thing of the past because this was quickly realized, and some of the societies which are professional bodies, in particular ISAPS, popularized and not popularized, corrected the perception and helped to bring the safety norms across the world, so that now we are not allowed to graft inside the muscle. It should be over the muscle. That means under the skin, where the fat is there, the normal
Right,
fat
exactly
is there.
the layer where the fat has to be.
Exactly. Okay. So now when this concept of putting fat into the muscle came up, I never was attracted to that. And looking back, I'm happy I didn't do it. I didn't do it. I always stayed above the muscle, and now it is proved that that is the safe plane to put the fat in.
Right.
If you put the fat in this safe plane, which I've been doing for almost 25 years, you have none of this bad complications, and it's a very, very, very successful and safe procedure.
Wonderful.
Yeah.
But coming to the Brazilian butt lift, how exactly you do the enhancement? You said you do it with fat grafting and?
It is done with fat grafting purely. In the definition of this butt lift procedure, it is purely fat grafting.
Purely fat grafting.
So when I say purely fat grafting, it also includes liposuction. Right. So what we basically do is you mark out the anatomical contours of the butt, and you have a 3D imagination of what you want to produce.
Right.
You of course discussed with the patient her desires, whether she wants more projection, more in the upper lifted area, she wants side butts,
Right.
or fullness on the sides. If she has hip dips, that has to be corrected. So basically you have the working plan model in your
Actually,
mind.
I think this is the best thing because you can remove fat from unwanted areas
Absolutely.
and use it in the right
Absolutely.
place. I mean,
Put it to
instead
good
of-
use. Put it to good use where you want
Wonderful.
it. So take it away from where you don't want it and add it to where you want it,
True.
where you desperately want it.
Absolutely.
So in a properly performed butt lift, within quotes, butt lift procedure, we are doing liposuction of the back, at least the lower back, the hip area,
Okay.
collecting the fat in a sterile container, and then we are going down to the outer thigh below the butt level. If necessary, we take fat from the inner thigh also. So all the areas
Wonderful.
around are contoured.
Beautiful.
Having done that, then we have the fat in the canister. We wash the fat briefly with saline to remove some blood, etc. Although there is not too much blood usually. Then the cleaned fat is then injected into the buttocks. So there are no scars. There's just a small puncture of 3 to 4 millimeter for the entry of the cannulas, and the fat is injected in layers.
Wow.
The thing is, this fat has to survive. It's a living tissue, right?
Right.
So the living tissue has to be taken out, which we call harvesting, gently, so that you don't traumatize the fat.
Right.
It has to stay in the canister, in a proper way,
Right.
and you should not keep it for too long. So we
Right.
need to graft it soon enough.
So you have to be very kind on the fat cells,
Kind on
otherwise
the
it will
fat.
die. It will not survive under the
Absolutely.
skin.
Now,
Right.
coming to the grafting part, you can't just stuff the fat. You have to layer it in multiple spaghetti lines.
I think this is what is
And
different
you have
in
to
different
leave,
doctors, right?
Yes, you have to leave space in between so that the surrounding host tissue will feed the new guest, which is
Right.
the fat
The
graft.
fat cells.
So the guest, that is the fat graft, has to be nourished for about 7 to 10 days by the surrounding tissues by way of diffusion. Diffusion means the nutrients are just diffusing through the intermediate serum, let's say,
Right.
until this fat tissue gets new blood supply. See, the fat tissue that we graft is not oil. If you take that fat and put it under microscope and see it in magnification, it consists of numerous fat cells with the network of fibers, with some broken blood vessels. It's a unit. It's a nest. This nest has to be revascularized, meaning that it has to get blood supply once again so that it can survive. But in this waiting period, and because of this trauma, even though we try to be gentle, some of the fat cells don't make it. So the survival of this graft is usually at best 50 to 60%.
Imagine the doctors who are not gentle. I mean, the results
the
won't be
technique-
that.
Absolutely. Fat
yeah.
grafting is technique dependent.
Right.
And one has to have the correct technique.
Right.
And therefore it takes time. And therefore it's not a procedure that you do in a rush.
Hurry.
Okay?
Right.
And now comes the point, how much fat can you graft? That depends on how much space there is.
True.
Okay. So you reach a limit when you cannot graft any more fat. And we must respect that limit.
Right.
You can always come back for a second grafting procedure 6 months later, and you can add more fat to that. And that's the way I like to go. If a woman says, I want to go really big, then I
Step
say,
by
do
step.
it in 2 steps.
2 steps.
Because in 1 step, if you simply stuff the fat, none of that fat cell is going to get oxygen.
They will fight with each other probably. It will stuff,
there,
no?
there will be no oxygenation for all
Oh
these.
yeah, I remember once you
And
told
they will all
me.
die.
Yes.
They will all die.
Yes.
They will all die.
True.
So that should not happen. So this is the way to do this procedure. So that's fat grafting, buttock augmentation by fat grafting. But there are other ways to augment the butt.
So there is a difference between, I've heard, buttock fillers and fat grafting. There's a difference between this, right?
Absolutely.
So what exactly is buttock filler?
So fillers are non-living substances. They are commercially produced. They are gels. And the gel, that approved gel, contains hyaluronic acid. What is hyaluronic acid? Now, hyaluronic acid is a normal substance present in human body, present in animal bodies. You can kind of say that it is the binding substance, which is there in between all structures in the body. And the fibers and blood vessels and everything runs through them. And it's the binding cement is the hyaluronic acid. Or rather, hyaluronic acid is one of the constituents of the extracellular matrix.
Right.
Okay, so the hyaluronic acid is produced by the body. There's continuous production. There's also continuous destruction, because body also has an enzyme to destroy the hyaluronic acid. Because a lot of molecules and structures in the body are in a state of flux. There is production,
right.
for some time it stays, and then it's taken away,
Destruction, right.
and then again reproduced, like red blood cells.
Right.
They have a life of 120 days, and then they are destroyed and recycled.
Right.
So hyaluronic acid is like that. So hyaluronic acid used to be taken from the cock's comb, which is rich in that.
Oh, really?
That is an animal source, but no longer. Now they have found the genetic code that codes for manufacture of hyaluronic acid and put it into E. coli bacteria. And the bacteria are grown in cultures in big tanks, and the bacteria produce hyaluronic acid in huge quantities. And that is then purified and produced as hyaluronic acid for fillers.
Okay.
Now you can imagine that if we put this hyaluronic acid filler, in a few months the body is going to dissolve it, because body has enzymes. So what the manufacturers do, they cross-link the molecule.
Okay.
So there's molecule here, there's molecule here. You produce cross-linkages so that it's more resistant to digestion by the enzyme.
Enzymes. Okay.
So it stays longer.
Stay. Okay.
Greater the amount of cross-linking, the longer it can stay, but at the same time, it also becomes denser and more difficult to inject. So you got to have a balance.
Okay.
So that is how the rheological properties, which means the flow characteristics of a gel, how easy it is to inject.
Okay.
How much power it has to do the lifting, the gel. It's called the G prime.
Right.
So there are various physical characteristics of the gel. By changing it, you can produce different products.
So you have to determine also which one is the better one?
So this
Because
is,
it must be different in the market, right?
This is done by the manufacturers, who then say that this product is for buttock augmentation and it has a lifting power. Okay. Of course, there are a couple of manufacturers. There are minor nuances of difference between different manufacturers, personal preferences, cost factor, and so on and so forth. But in general, most of the hyaluronic acid fillers made by different manufacturers are sort of similar.
Similar. Okay.
So when we inject that, and it comes in 10 cc syringes, you can produce volume, you can produce a lifting effect or a filling out effect. Okay. Now, a 10 cc has a certain cost, let's say. So if somebody wants a significant visible change, at least you need 50 to 60 cc per side.
Each side, huh?
Each side, minimum, okay, to produce some visible change. Ultimately what, and this can stay for about 1.5 years, max 2 years.
1.5 years, okay.
Now, the point here is that buttock augmentation by filler is easy. It's an outpatient procedure. It's under local anesthesia, almost no risk, easy to recover.
How long it takes?
It takes an hour.
For the whole procedure, for both the
including giving the local, cleaning the place, cleaning the area, skin with disinfectant, and giving the local anesthetic, filling it.
Same like the face fillers, basically.
But it's a bit longer because we are using multiple syringes. And then she just gets up and goes home.
Under local anesthesia? So it's a clinic procedure, low downtime, almost no downtime. So that is an appeal. Okay, and you have an instant fix. Wow.
Okay, but the amount of enhancement that you can produce with filler is limited.
Why so?
Because in fat grafting, we are, let's say, putting minimum of 300, 400, 500 cc per side. Compare that to 50 to 100 cc per side.
Right.
And because in fat grafting, the cells are cells, they integrate with the remaining cells. So pretty soon after 10, 15 days, it's body structural tissue. Right. It's nothing free floating.
Right.
Whereas when you inject gel, it stays as gel. And you can't inject 200 cc of gel there. It'll be like a huge space filled with only gel.
Right.
And it'll wobble here and there. And that's not on. So you can't do that. So then who is for filler? Who is a suitable candidate for fat graft? And we haven't even talked about buttock implants. We can come to that in a moment.
Oh, yes, absolutely. There's one more.
There are implants.
But then, Dr. Mohan, how a person can gauge, if, like, for example, fillers will stay for 1.5 to 2 years.
That's right.
How long fat grafting will last?
You can call it almost permanent.
Wow.
After the survival is done, by 4 months, all these ups and downs are over. And we usually tell the patients, at 4 months, what you have, this is your fat. This has come to life. It's now having a new home, and it's there. Now, just like a living fat, if she gains weight, this will grow. If she loses weight, it will shrink.
Wonderful.
So it is part of her
it's
body.
It's worth putting the time and effort.
It is her own cells.
Right.
Now simply living in another part of her body.
Beautiful.
Yeah.
So the buttock, the fat grafting, it's a day procedure also. 1 day stay. Or how long it takes?
Yes and no.
Okay.
So bigger butt augmentations, because they may have some discomfort from the liposuctioned areas. The butt itself is not painful in this.
Okay.
So we sometimes recommend them to stay overnight. Also, after buttock augmentation by fat grafting, we recommend them to sleep prone position.
Prone as in on the
face down.
On the face down. Right. Okay.
So that the buttock is offloaded from pressure.
Right.
And the first week is important because this fat must get its new blood supply. That's not the time when it should be moving around or it should be pressurized, etc.
Right.
No massages allowed, no nothing allowed. So when she goes home, we encourage her to also spend time sleeping, prone position, and she can walk about. And when she sits on a chair, she should sit very carefully, taking the weight on the back of her thighs and not leaning backward to squash the area where fat has been grafted.
Okay.
So these precautions are important.
So how long a person has to be precautious or take care?
Taking precautions, yes. I would say the first week to 10 days are very important.
Okay.
After that, my practice is to let them have more freedom. I know that many doctors almost restrict them for a month. But it's not practical. And unless the woman is really motivated and has the free time to indulge herself, she may have to go back to her job and she may have other things to do.
Right.
So generally, for me, based on the principles of how a graft will get new blood supply, which takes 7 to 10 days.
Okay.
So during that period, she has to offload that area.
Wonderful.
There are some devices available. These are popularly called BBL pillows. So you can actually use them.
Oh, you have BBL pillows as well?
Yes.
Okay.
Yes.
I heard only till now pregnancy pillows. All right.
So if she wants to sleep in a normal position for some time, she can insert that under the lower part of the back.
Okay.
So that the pressure is not on the butt. Similarly, if she is driving the car, she can have this under her thighs.
Okay.
So the weight is on the thigh and the butt itself is offloaded.
Oh, wow.
So there are these precautions that can be taken for this.
Wonderful. So then what about buttock implants? I mean, even when you want to grade, how would you like to grade these procedures? I mean, we will talk about this probably maybe after implants.
I would say in terms of the result that can be produced and the longevity of the result and also freedom from trouble, fat grafting is the best.
Wow.
Is the best. Of course, it takes a little bit of time in the post-operative period, as I told you. And it's compared to fillers, it's a much bigger procedure.
Right.
Okay. The cost eventually is higher in the fillers because you'll have to do this every 1.5 to 2 years, and the fillers are not very cheap.
Agree.
And because multiple syringes are required, at least 10 to 15 to 20 syringes in one episode. So the cost of that many number of syringes plus the procedure fee comes almost close to the fat grafting.
Okay.
Okay, so fat grafting in the most cases is just required to be done once.
Right.
Maybe if you want a higher volume, then do it 2 times. Now, buttock implant is
Implants.
a completely different story altogether, because here it's more invasive. We are placing the butt implant, which is a silicone implant, just similar
just
to
like
breast
breast implants,
But
right?
breast
I
implant
wasn't
is-
aware that
breast
we do
implant is-
implants in buttock also. Okay.
Yes. Initially, the same breast implant was put in the butt, but later the manufacturers do now manufacture specialized buttock implants, which
Okay.
come in different sizes,
Uh-huh.
and that is placed inside the gluteus maximus muscle. Again,
Inside the muscle.
the muscle, which sounds very strange. You can think, and it sounds logical, that okay, you place it either above the muscle or below the muscle, taking a cue from the what we do in the breast.
Right.
Both have been tried, and both have had their share of problems,
Okay.
until somebody said, put it into the muscle, separate the muscle
Between the
into two
fibers.
lamina,
Okay.
and then find a plane, create a plane, and then place it there, and there the buttock implant lies there securely, protected by muscle above, protected by muscle below. And it was counterintuitive, but now it is known that that is the correct way to do it.
Really?
Yes.
I think it will keep in its place, no?
Yes,
it will hold
it holds in its place, and with the proper technique, one can do it without too much bleeding or trouble. But as must be, since you are a physician yourself, you know that by now it must be obvious to you that splitting the muscle down the middle does involve bleeding, is technically demanding.
Absolutely.
It can be
When
technically
you told
demanding,
itself, I was like, okay.
and it will be painful in the post-operative period. At least for first several days, it will be painful. The restrictions are more. She will have to gradually come back to activities. The commitment from the patient is high. So unless the patient is committed, has protected time for the post-operative period, has the right mindset to be able to, tolerate some pain and discomfort and slow recovery. So buttock implant is not for everybody. Buttock implant is not for every patient. It's not for every surgeon. So
Right.
therefore, its use is limited. While at the same time, buttock implant is probably the only option or the most appropriate option for some women
Okay.
who are so thin that there is hardly any fat on their body, or they don't have enough fat to be able to do a fat grafting
Okay.
in a satisfactory
In
way.
those cases.
Or they would have already done liposuction of multiple areas, which is commonly the case in many patients that I see.
Okay.
So fat grafting as an option is out.
I agree.
Then you're left with filler or
And implants.
implant.
Right.
Now, if she wants a big augmentation, it will have to be implant.
Right, but all these the shapes of the buttocks which you told in the beginning, the V shape, the square shape, so all these can be corrected by fat grafting.
Very good question. Can be corrected by fat grafting,
Wonderful.
but cannot be corrected by implant. But implant only gives projection in the central part. It gives projection where you place it.
Right.
Now, it's easy to imagine that a buttock implant in the middle, inside the gluteus maximus, is going to do nothing to the hip dips. It's going to do nothing to the A shape or the V shape. So, for alterations of the shape, fat grafting. And it's not that this or the other. Sometimes you can do fat grafting and implant at the same time in the same patient.
Okay.
Yeah.
Wonderful.
Personally, though, I don't like to do buttock implants simply because I think the slightly higher complication rate and the difficulty in the post-operative recovery is probably not something that most of the women, at least the kind of clientele that I have, would be willing to face up to and undergo. Okay?
True.
So there may be a lot of enthusiasm in the beginning.
I mean, the discussion
But-
itself brings
but-
me goosebumps and scares me. I don't know how people will go through this procedure.
So there may be a lot of enthusiasm.
What is the ratio
but,
of
later
patients
on, yeah.
coming for the buttock implants and the fat
So
grafting and fillers?
what happens is a lot of people who read up here and there, and then they come asking for a buttock implant. I say, okay, sit down, let's talk.
Let me tell you the story.
No, it's not. No, it's not that. I tell them the truth, and first, of course, I
yes,
examine.
of course, the truth.
I
Yes.
examine them, and many of them end up being suitable for a fat grafting.
Really, I mean, that strong-minded people
Well,
definitely
I talk
requires.
to them once or twice, and I'm able to show them results of fat grafting. But they come with some fixed idea that okay, I must see. They take a cue from breast implant. Okay, breast implant is fantastic. So okay, let me have a butt implant.
Right.
And they would have heard stories from some of their friends, oh, this fat grafting doesn't survive. It's only for 6 months and then it disappears. It melts away. In fact, it takes a lot of effort from my part to change that perception that they already come preconceived notion that fat is going to dissolve. Okay.
Right.
So, or I don't have enough fat, or I'm thin. See, if she has not done liposuction, and if she is kind of averagely thin or slim, I can still find enough fat on her body. Unless she is really skinny, then there are some women, genuinely there are some women, I can't find fat on them. Or not, at least not enough for a buttock augmentation. But a lot of women, by taking fat from multiple areas. So here it's a bit different. We need to collect a lot of fat.
Right.
So I might end up doing liposuction, not just around the butt for the shaping part. I might take from the abdomen.
Under
I might
the
take
arms.
from the thigh. I can take from the arms if she has excess there. So all these areas, all the fat is pulled together. And then we reach a figure like 600, 700 cc. Okay, I have enough now to do the augmentation.
3D defined body you get along with buttock fat grafting.
Yes. You come for a buttock augmentation by fat
And you
grafting.
get a 3D defined body as
Yes, you get a bonus.
well.
You get a bonus in all the areas where the liposuction is done. That's
Wonderful.
true. That's kind of like a free bonus.
Free bonus. That's nice.
Yes.
So, Dr. Mohan, how exactly the journey of a patient looks like, including the procedure, how it's done? For let's start with fat grafting. How does it look like and how it's done?
So the consultation is very important. I show them a whole lot of pictures in my PowerPoint so that they get an idea about realistically what can be achieved.
Right.
All right. And then I also educate them about the surrounding work that they do. It's not just pumping fat into the butt. It's also contouring of the area perigluteal around the buttock, which is also important. So these concepts have to be
Clear.
explained.
Right.
And the limitations on the quantum of fat that can be grafted in one session and why. The story of survival of the fat, the biology of it. All these concepts have to be explained.
Right.
So I take a lot of time in explaining these consultations to set the expectations right. Then we choose a garment for them based on their body size, etc. Because post-operative they wear a garment, both for the liposuctioned area and also to support the buttock area.
Okay.
And then on the day they get admitted, and we are collecting the fat first under. Okay, this is an important question. A lot of people are asking me, do I need full anesthesia for it? So most of the time I do it under local anesthesia plus sedation.
Whoa.
So the anesthetist gives sedation, I give a lot of local anesthesia, and I harvest the fat.
No general
pain,
anesthesia.
No pain. General anesthesia is not required.
Whoa.
No pain. So the fat is all harvested, and then the fat is grafted also under local anesthesia, and the whole procedure is over. Now, after this is done and finished, and she wears the garment, she comes back to her room, and she recovers from the sedation in 3 or 4 hours. Then she gets something to eat and drink. She walk about, and once everything is all clear, she can go home in the evening.
Just
And
4
with the
hours after the procedure all
she can go
set.
home. Yes.
The procedure lasts for an hour.
No. It's longer, depending on how easy it is to get fat.
Fat harvesting.
I would say easily 2 hours, sometimes between 2 to 3 hours.
And everything under local and
And
sedation.
local and
Wow.
sedation. Yeah, that's right.
Wonderful.
So that's how it is done. And after that, she goes home, and then she'll come back after 4 or 5 days for the first post-operative visit when we check out everything is okay. We just give them 2 doses of antibiotic. They don't even go home on antibiotic prescription.
Okay.
Only some pain medications and medicines
Oh,
to
no
reduce
antibiotics as well?
reduce swelling. No, just 2 doses. 1 dose or 2 doses. That's
Okay.
all. That's
Okay.
all. To
Wonderful.
perioperatively. And I ask them to take some multivitamins and also eat good diet. This is not the time to fast and go on a reducing diet, because it's obviously contradictory, right? On the one hand, you're trying to enhance your butt and make the fat graft survive. On the other hand, this is
You're
not
dieting.
the time to do dieting and severe exercise and burn the fat and all that. So that's obviously
Right. Let your body heal and accept what you
one
have gone
important point here, which I forgot to mention, is smoking. If she's a smoker, she has to quit 3 weeks before, and she has to stay quit until all the fat is properly integrated and everything is surviving good.
through.
Okay?
Wow. So probably the ladies who are not able to
And-
quit
and then they
smoking
will
can go for fat grafting.
And then they will ask me, so when can I restart? I will say never.
This is
as
what
a
I'm
doctor,
saying.
as a
This is what I'm
doctor,
trying to
I
say.
will never say, okay, now start.
I would say this is also a bonus. With 3D body contouring, you get a quit smoking along with
Yes.
fat grafting.
But it's important that if she continues to smoke, then the baby fat, I call them babies. I
Right.
say these babies, you can't feed them
You
tobacco
can't kill
smoke.
them. True.
You need to give them food and vitamins.
Agree. Not smoke. But beautiful. I mean,
so that's the journey.
that sounds pretty smooth.
That's the journey for fat grafting.
Wow.
And surprising that how pain-free that butt area is even after all this fat grafting. Now, here I use the modern technique of expansion vibration fat grafting. Now, what is this? Here, the fat is being grafted using power-assisted equipment where the cannula vibrates. And the cannula has a little flared end. So when I'm going in, the flare creates the passage and the fat is deposited. And because the cannula is all the time vibrating, you don't put fat in the same place twice.
Okay.
So it's kind of distributing the fat everywhere, and while the recipient area is also getting expanded. So with this technique, for example, formerly if I put 400, now I can put 600 easily.
Right.
Per side. So expansion vibration technique we use. Another modern advancement is to use ultrasound to guide where you are putting the fat so that you don't enter under the muscle.
Okay.
I'm not routinely using ultrasound. However, since I'm doing it under local anesthesia and sedation, the muscle is having its normal tone.
Right.
So even if I go and touch the muscle,
You
I
will
will know.
realize
I will
it.
know.
Yes.
And the most important thing is your other hand, because your other hand must always know where the cannula end
is moving.
And then the direction, you never go towards the butt muscle. You always go tangentially. So if at all, you'll go towards the roof and never into the muscle.
Right.
So there are safety points where to enter from, how to direct the cannulas and all that. These are technical details to make sure that you never enter the muscle. And then it is safe.
Wonderful. Which is the most preferred one, the technique?
Well, currently the vibration expansion is
The
best,
most preferred
is
one.
the best.
Perfect. So this is a journey of
For the
fat grafting patient.
Now filler is very simple. They come, they have a consultation, they get the estimate of, how much they're going to spend.
Right.
And then they lie down prone in the clinic side room. We clean the area with some betadine or something like this. We do sterile draping. We follow all sterile precautions. And then these syringes are opened and we give local anesthesia. And then we enter through the local anesthetized area and we inject in different planes, different directions.
Okay.
And she's comfortable throughout this procedure. She can either listen to music from her mobile phone or talk to us.
Okay, is that comfortable?
It is that comfortable.
Wow.
It's easy. And then we can also check it out. We'll ask her to stand up the last few syringes and then do some fine tuning in a standing position, because with gravity things change.
Right.
So
Agree.
we can do the fine tuning also.
Wonderful. So how long does procedure last?
The actual procedure is about half an hour. Before, after, add another 20 minutes. Depends also on the personality. Depends on the personality also. Some people who are not too anxious, we can finish it quickly. Those women who are over anxious, we got to go slow.
Okay.
Give the local, do talk therapy.
Right. So 30 minutes to an hour.
To an hour.
Okay. And the strongest one land into buttock augmentation. Buttock implants.
Well, implant is for a selected few patients.
Right.
And then they must have at least 2 consultations. And they must know the potential complications. And
agree.
they must know the possibility of some duration of pain and discomfort following. Of course, the pain can be controlled by medications. It's not that horrible.
I'm sorry, we didn't finish fillers. So the patient will be discharged the same, like in an hour max.
The patient is not even admitted, right?
Oh, right. We did
It's in the clinic.
Oh, yes, it's in the clinic.
It's in the clinic.
Wow.
They finish the procedure, get up from the couch.
And back to normal, antibiotics and all that?
Well, we cover with antibiotics, oral antibiotics, which they take at home.
That's
Simple.
it. And the precautions and all stay the same, like how it's in fat grafting?
Well, anti-smoking is not so important here.
Right.
Because you're not injecting living things. It's a non-living thing.
Right.
However, and the local area must be clean. There should be no ongoing infection like throat infections, skin infections, vaginal infections.
Okay.
Obviously.
How about the pain? The pain is, there's no pain. The person can get back to normal routine the same day.
Yes.
Okay. Wow. But then the drawback is 1.5 years only.
Yes, that. Yes. And then you cannot make very big enhancements. That's
true. So then coming to buttock implants, how does the journey of a patient looks like?
Okay.
And how the procedure is done?
So once the decision is made, we then have to order the appropriate implant. We do sizing measurements. on her body
Okay.
and see what's the diameter that is required, what's the projection that is required. Maybe we will order 2 types and then decide exactly.
Do we have still again that machine which was there in breast implants? You mentioned that we put there is a machine which can really show how your breast looks like.
Software.
There was something you mentioned.
Software, yes. Some of the softwares also have the module for buttock augmentation.
Okay.
But it's not been so very well developed as it is for the breast.
For the breast, okay.
But in buttock augmentation, usually you don't need that. So you can take simple measurements, and there is not such a huge range of implants also. There's only a limited range of implants.
Right.
So we use those, we order the implants. And then on the day of surgery, of course, here we take more precautions with, against infection, let's say. So for a couple of days, she will have to shower her body with chlorhexidine or betadine type of washes to make sure that skin is absolutely clean. A lot of precaution is taken against infection. And it is usually done under general anesthesia in prone position. So the incision is hidden in between the butt cheeks.
The cut is
The incision,
the cut basically.
yeah. It's hidden inside. So it's not visible.
Inside the lower curve?
No, not
Inside
the lower
the inner curve?
No, yeah, inner curve.
Oh.
In between the
The
two
gluteal
buttock
line.
cheeks,
Oh,
what is
okay.
called the natal cleft.
Okay.
Natal cleft. And it can be hidden even if she is wearing a thong.
Okay.
Nothing is visible.
Wow.
The entire butt can be exposed and there is no scar.
Wow.
So the scar is in the midline, hidden.
Oh, I'm sure you have to be very careful with that procedure.
Yes. So
Wow.
from there we make entry into the right and the left side, make a small dissection. After that we expose the muscle and then we get into the muscle in the right plane. There are special instruments for it. Once you have developed that plane and split the muscle into upper part and lower layers, and now you have this layer in between, and in that layer you will put the implants. And then close the muscle, close the skin. There's a special precaution in how you close the skin. That's getting too technical, so that it doesn't open up.
Okay. Yeah, because it's too tight in that area,
Yeah,
the skin.
informally, people used to make an incision and close it there. It splits open. So now we do something else.
Okay.
Okay, we do it differently.
Your expertise still
so that
I'm
the
sure
closure
there's something.
is still in the midline, but
Right.
inside we have done something different.
Wow.
Okay, so that it doesn't open up. And you may or may not leave a drain,
Okay.
which is like a tube to bring out any blood, etc.
Okay.
And then she sleeps in this prone position, preferably overnight, because she might have pain. She might need IV drugs for the pain control.
Okay.
And generally by next day she can go home, and she will follow all the precautions as we have discussed earlier, and take medications for about a week to 10 days.
Okay.
And so that's the journey in a buttock
That's how
augmentation.
it looks like.
Yes,
And then
yes.
when can that person be back to routine?
Well, she can walk from the next day. Walking is allowed. Sitting gently without taking weight on that area is also allowed
Okay.
for short time. She will definitely need 5 to 7 days of convalescence period after this kind of a procedure before she can gradually get back to her
Routine
activities, but still not for gym, still not for bending and lifting weights and all those things until it is properly healed, which is probably a month.
A month
and
it
a
takes.
half. Yeah.
A month and a half also
Yes,
it can go
it
to.
can be.
Whoa. Dr. Mohan, what should a patient look for when a patient wants to go for a buttock augmentation? What is exactly they should look for in a surgeon?
So also a corollary on this is like how the discussion with the surgeon should go.
Right.
Because basically some women come with fixed ideas that I want this and I want that. If she comes with a more open mind and knows about all the possibilities, unless she's already done the research and she knows a lot. Or else it's up to the surgeon to educate her, to give her the options. Okay, filler is possible, fat grafting is possible, buttock implant is also possible in this subset of people.
Right.
So she has enough information to make a decision.
Right.
All right. Now, in terms of what kind of surgeon she should choose, obviously a surgeon who's doing this frequently enough, and a surgeon who can show her his own results, his or her own results. Usually I show the PowerPoint presentation of some of the previous patients where they can clearly make out what the shape was, the overall shape, and how the butt fitted into the overall shape, and how post-operatively how the shape changes.
Okay.
So that is quite good for them to know. And the complication rate that the surgeon has faced.
Right.
And an honest discussion on what is possible and what is not possible. See, quite often it is to give the correct ideas. Because sometimes people come with, they look at these people's photographs. Generally, what will happen, she'll come to me and she's going to show me something from her Instagram, and I immediately know what she's going to show me. Because there is one black woman whose photograph is very popular among patients.
Really?
And she's slim, she's around 20 something.
Uh-huh.
I don't know who she is.
Okay.
And she has a nice bottom. And then they will show, I want this.
Okay.
So we have to gradually educate them and talk to them about
Absolutely.
the
So I think overall
racial types, the
explanation is
genetics
very
and
important.
everything. Very, very important to set the expectations
You might
right.
come across 1 or 2 consultations or even more than that for explaining patients what exactly it's all about, no? Because I'm sure...
I insist on 2 consultations.
Oh, you go for 2 consultations. Wonderful.
Yes.
That's
because
great.
by experience, I know that in one consultation, whatever I have told, all of that information has not
It's
sunk
too
in.
much to take for people.
Information overload could
Yeah.
be. Could be.
Yeah, that's wonderful.
Yeah.
So that's how a person can check for the right doctor, right? The right
Yes.
surgeon.
Yeah, the right
for
surgeon
the
who's
procedure.
doing this and whose patients have, where he can show long-term results.
Right.
See, in the short term, within the first month, you can balloon out the tissue and it looks big.
Right.
But what happens after 6 months? What happens after 1 year? That's
Right.
important.
Absolutely. So in these all 3 types of procedure,
Yes.
Dr. Mohan, what kind of different scar like patients can expect, like
Okay.
for each?
So, as should be obvious by now, in filler, there is no scar because we are only injecting by thick needles.
Right. The thick needles don't leave scar
No.
because the big. I
Well,
think,
it's not very, very thick. I mean, it's 18 gauge. It's
No scar.
not going to leave any marks. No.
wonderful. Okay.
And fat grafting, the incision is around 3 millimeters through which we insert the cannulas to graft. It's just a speck.
Mm-hmm.
And I keep one close to the midline so that it can be easily hidden. The other one is also in the panty line.
Mm-hmm.
So in a normal female panty, these small cuts are hidden.
Not visible.
Are hidden.
Okay, great.
The buttock implant scar, as I told you, is in the midline, is actually invisible unless you open the cheeks like this and look there, you will see the line.
Okay, that's nice.
So in all 3 options, you can forget about scar.
That's nice.
Yeah.
Cool.
So I would like to take this opportunity to deliver a very important, strong message to the audience out there.
Wonderful. What's that?
And what is this?
Uh-huh.
This is because every week I'm seeing people who have had their buttocks injected with unknown illegal substances
Whoa.
by unqualified persons who've been injecting them in their own home.
At home? Oh
At
my
home.
goodness, really?
This woman comes to their home and obliges them. So the women, they are very happy that in the privacy of
Oh my God,
home,
really?
somebody can come and inject. And
Like, it's like a massage or something?
she
Oh my God.
charges 5,000 dirhams.
Oh.
And she injects them with unknown substances, calling it as collagen. Okay.
Blunder.
And she say, oh, it will stay for 2-3 years and it will go away. It is very safe. I have lots of satisfied customers and so on and so forth. What she injects, only she knows.
Oh my goodness.
Okay.
Scary.
Now, this is just part of the story. Then some of them are so impressed by, because initially it looks fine.
Mm-hmm.
And so they call her again and have more injected. And today I saw a woman who's had 4 rounds of injections done by the same woman, inviting her to come to her home and inject her. And now she is with me with problems. Because problems will start happening after a few years, because this filler, whatever she's injecting, is permanent.
Right.
And we know by now that this is silicone oil.
Oh.
Silicone oil, no doctor uses in any medical procedures.
This is so dangerous, my goodness.
So the silicone oil, it breaks into smaller droplets and causes a lot of fibrosis and hard masses and whole lot of problems. So anyway, this is not topic of our discussion, but I just want to tell people that do not go for these cheap offers of an unknown person, unlicensed. By now they should know
True.
that this kind of a service offered by somebody and they are invading your body by injecting something, and they're not doctors. They're obviously not doctors.
My goodness.
They're obviously not licensed. And I fail to understand the thought process of women who are going for this kind of procedures still today. In
My
this
God.
country, it happens. In many of the nearby countries, it happens. All over the world, it happens actually.
I'm surprised.
So this is.
How can someone to get this kind of procedure
this
done
is
at home?
so I just want to caution people:
Wow.
don't do this.
That was
because
really
this is
great information.
playing with
for
your health, and Those people who have already done it, and if they are suffering, I am offering solutions for this. I am treating almost one patient every week. I think in the last 6 years or so, I've seen about 140 people with this problem. I've treated about 60 to 70 of them.
Oh my goodness.
So I have evolved certain ways of treating and getting rid of this.
Wow.
This
I mean, we have
illegal
done
substance.
really a great job by discussing this on our platform, making people
Thank you.
aware that this kind of practices are also
Yes.
happening.
Yes, yes.
And they should be aware of it.
Yes.
Wow, wow.
So that should not be done.
Oh, absolutely,
Obviously,
absolutely.
obviously.
I'm so glad we discussed about it. So that was really a great discussion. I mean, I was not expecting it will be this descriptive and knowledgeable. I'm sure our audience is going to get benefit out of it. Thank you so much for being
You're very welcome.
giving
as
me
always,
the company.
as always, as always.
Thank you so much, Dr. Mohan, and looking forward for our next topic to discuss further
And
for
I'd
our
like
audience.
to I'd like to tell the audience that if you have any topics in mind, you can please put it down in the comments below, and we will certainly consider having a session discussing those topics
Absolutely.
that are of interest to you. And if enough number of people request a particular topic to be discussed, then yes.
Absolutely.
we can do
Please feel free to put in your comments what exactly is any specific topic you want us
This
to
is your
discuss
channel.
about.
This is your
Exactly. It's
channel.
all for you. It's everything is for you. This all time which we are putting is to create awareness among you people about like the plastic surgery. There's so much of hype coming in the industry because of the Bollywood, Hollywood, whatever you call, so many procedures are done. So keeping your concept clear and having a proper knowledge about these procedures, that what exactly is right for you and wrong for you, is our mission with this channel, Dr. Mohan's mission, my mission, to create that awareness. So please feel free to put your doubts or concerns or any kind of questions you have in comments. We will definitely discuss that in our future upcoming podcast, and we'll get back to you in the comments as well. Thank you so much. And thank you once again, Dr. Mohan.
I just want to say a last comment that
Yes.
plastic surgery can really be magical in its transformation, but we want safe magic.
Yes.
So the whole idea is to have the magic,
But a safe
safely,
magic.
Safely.
There you go.
Safety in magic.
Wonderful.
Thank
you
you.
so much, Dr.
Thank
Mohan.
you.
Thank you once again.
Bye-bye.
Dr. Mohan Rangaswamy, turning your dreams into reality with precision and care.